Ooh. Hello, YouTube. Just getting Facebook started here. Give me one quick sec. Oh, joy, oh, joy, oh, joy. There we go. Ah. Come on, computer, cooperate. I need you to cooperate with me. There we go. Hello, YouTube. All right, let's see. Live, I see. All right, let's see if we can get this stream on Facebook started. All right, here we are. Hello, my friends. It's Jill Osborne from the Interstitial Cystitis Network. It is Sunday, February 11th. It is Super Bowl Sunday. What does that mean? It means that we're probably not going to have a lot of people at this meeting today. That's fine because a lot of people watch it afterwards. And so my purpose in doing these meetings is just to share all the latest information on IC, to take questions and all that sort of good stuff. So let's just see what happens, because if we finish early, that's fine. I'll go watch Super Bowl. If not, I'm happy to take your questions and let us go from there. So my name is Jill Osborne again, founder of the Interstitial Cystitis Network. I'm the longest serving IC support group leader in the world at over 30 years and counting. I bring to you a bunch of college degrees because, hello, I'm a geek. And I curate the Interstitial Cystitis Network website. I'm also an IC researcher, currently serving on the guidelines committee with the American Urology Association to develop new resources for men with pelvic pain, new clinical guidelines for men with pelvic pain. I am also a lecturer right now this year in a pelvic pain series with the International Continence Society, and doing quite a few other things right now. My office is very, 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 very busy these days. But I want to apologize first for not being able to do a meeting last weekend. We could not do a meeting last weekend because we had a ginormous storm here in California, and we had no power. And it was just stunning. I'm amazed the windows right here didn't blow in. It was like my home was being hit with trains over and over and over again. We really thought it was tornadoes. So I'm back again this week, and let's just go ahead and get started. So I got a bunch of news. First of all, for anybody who's struggling with pain, We have 2 fabulous clinical trials right on our website that you can participate in. They have centers across the United States, and I encourage you to go over to icnetwork.org. Right on the front page, you'll see 2 clinical trial listings, one with a bright yellow picture, one with a picture of a woman in a garden. Please check on those. Now, these are 2 studies that are seeking women. Men, take heart. We always also have studies for men with IC. We just don't right now, but I'm always thinking about you, and I'm always working on creating resources for you. So for the men out there, I don't want you to think that we are ignoring you. We are not. Um, Hello, Anne. Anne says, "Are leukocytes positive on DIP? Does that mean UTI?" No, that can just mean a bladder wall irritation from a bladder wall flare. It's the positive nitrites in a urine dipstick that's going to be indicative of a positive UTI. So if you've had a flare from you drinking a cup of coffee, then that would cause some leukocytes in there because the coffee irritates the bladder wall. Coffee goes where it's not supposed to. The body mobilizes your body's army to come in and kill the invader, which in this case is not infection, it's coffee. And that causes leukocytes to swarm the area. And that's why you tend to have more leukocytes in your urine. Um, okay. So on that topic, I am writing right now. I should be finishing it tonight. Our Winter IC Optimist magazine, which is our patient magazine that goes to patients and providers around the world. And in fact, for our international customers, please know that we will be turning on almost every international country in our store. We've had to have it turned off for a number of reasons. So we're going to be able to continue to send IC resources and books electronically, which is great. So stay tuned on that. So I happened upon an absolutely fascinating research study because I have something that annoys me greatly, and that is people who suggest that I see it's all in our heads. People who suggest that perhaps we're mentally ill, and of course we know we're not. We know that a lot of different things can cause pelvic pain, like falling on your tailbone, breaking your tailbone, going through chemotherapy, etc. But there's always like this undercurrent of ugliness that every single IC patient out there has experienced, that at some point in time, someone has said, "Isn't that all in your head?" They've implied that. And sometimes we hear the word, "Oh, you're just depressed." Get over it. Get over it, Jill. Okay. Well, well, we have a brand new study that has now linked bladder inflammation with depression. So you know how you think, some people think, well, maybe it's all in your head and it goes all the way down, which of course, not true. Remember, we're subtyping. We've got central sensitization. We know that's an injury to the central nervous system. There's nobody out there in medical research who says, oh, this all begins in your brain and this is all mental illness or this is all related to depression. We know that that's absolutely not true. We are all focusing on the concept of an injury or trauma. We're talking about physical injury, especially injuries in childhood. We're talking about traumatic injuries, being abused, et cetera, et cetera. We now know that not only can the bladder wall be injured, but we know muscles can be injured, and we know that nervous system can be injured. And of course, if you've been diagnosed with quote unquote an incurable condition, and you're worried about your employment and you're worried about your ability to provide for your family or to be a wife or to be a husband, are you going to be upset? Hell yeah. Are you going to be depressed? Yes. Wait, Christina says can't hear it. Wait, hold on. I've got the sound. The sound is good here. For those of you on Facebook, can you hear me? For anybody on Facebook, can you hear me? Can you hear me? Okay, Elizabeth says she can hear. Excellent. Anne says she can hear. Paula says she can hear. Okay. So again, with all of our research now, we're really focusing on the concept of traumatic injury or trauma. So now we have this new research study, which is actually helping us understand why bladder injury can actually get to the central nervous system and kind of also injure or inflame the central nervous system, which can lead to depression. So I just want to read this to you a little bit. I mean, and I'm going to make sense of this for you. So why, oh, why do some IC patients struggle with depression? Certainly, lack of consistent sleep could be a cause of intense, persistent pain. Having a doctor tell you you have an incurable disease, which is an outdated and incorrect conclusion, certainly upsetting. But what if there was a physical reason for that depression? Last year, researchers at Duke University made a rather remarkable discovery that inflammation in the bladder is converted to neuroinflammation in the central nervous system, which can then trigger depression. In other words, depression can be the result of injury and long term inflammation in the bladder, driven perhaps by a daily cup of coffee, drinking soda, or smoking. So when someone implies that IC is, quote, all in your head, this research proves that depression might not begin in the brain or the central nervous system, but rather directly in the bladder. This brings to mind the thousands of IC patients over the years who've shared that they only drank soda in their young lives. Could that persistent damage to the bladder wall over time lead directly to inflammation in our nervous system and our brain, resulting in a depression? It appears it could. So, inflammation is a process your body uses to fight injury or infection. When your bladder suffers an injury or an infection, and inflammation is a normal part of the healing process. If, for example, you get a UTI, your bladder wall may turn red, swell, and physically hurt. If your bladder was red during a cystoscopy, the odds are that inflammation was present. And yet, once the UTI is treated, that inflammation usually resolves. Now, of course, patients with Hunner's lesions suffer from severe inflammation, with several studies now linking viral infections as a cause of Hunner's lesions. That makes complete sense now. But there is another more devastating type of inflammation. Chronic inflammation has been linked to many life-threatening conditions, including type 2 diabetes, non-alcoholic fatty liver disease, cardiovascular disease, cancer, depression, autoimmune disease, and others. And the triggers for chronic inflammation are going to be physical inactivity, visceral obesity, intestinal dysbiosis, poor diet, social isolation, stress, poor sleep, and exposure to toxins, such as industrial chemicals or smoking. Now, neuroinflammation, which is inflammation that hits nerves, occurs when there's an inflammatory response within the brain or the spinal cord, often after a traumatic brain injury, infection, or autoimmune dysfunction. So think about meningitis, spinal meningitis. That's an example of a bacterial infection that can affect the spinal cord. Neuroinflammation has also been linked to depression and several brain diseases, including Parkinson's. So clearly, inflammation can persist throughout the body. And in the typical IC patient also struggling with depression, this research team encourages doctors to treat underlying inflammation to bring both urological and psychological relief. And this is where we, the IC patient, can take firm action to help reverse inflammation and reduce depression. To fight inflammation, we have to simplify our diet and lives, focusing on better food, less stress, more fulfilling relationships, and sleeping well. So, Number one, how can we reverse inflammation? Lori's asking for the article name. It's going to be in our magazine. So just hold on. How can we reverse inflammation? Number one, eat anti inflammatory foods. Your food choices can protect you against inflammation. Eat more fruits and veggies and foods that contain omega 3 fatty acids, such as leafy greens like spinach and kale, cruciferous vegetables like broccoli and cauliflower, nuts and seeds like flax, almonds, chia, kind bars. I eat a kind bar every day. Fruits like low acid gala or Fuji apples or blackberries. I love blackberries. Fatty cold water fish like mackerel, tuna, and salmon, not my favorite. I'm a terrible Norwegian. Olive oil. In fact, now when I bake almost exclusively with olive oil. And of course, some spices like ginger, rosemary, and turmeric. Number two, quit smoking. Why is smoking the number one cause of bladder cancer? Because the byproducts from smoking, vaping, and chewing accumulate in your urine where they bathe the bladder wall with irritants. And for the unlucky, these toxins trigger the development of bladder cancer. But did you know that children exposed to secondhand smoke can develop urinary symptoms similar to IC? That's because those airborne toxins are irritating their bladders too. And please note that while vaping has been considered healthier than smoking, recent studies have found high levels of certain carcinogens in their urine too. Number three, hi Rhonda, limit alcohol. This isn't a stretch for most ICers given that alcohol can trigger flares, but for those of us who can tolerate alcohol, it's important to note that alcoholic beverages are inflammatory. I have cut out almost all alcohol. I never drank a lot anyway. If I ever did, it was like one hard cider. But I am very, very determined to get my body as healthy as I can. So alcohol's over for me right now. Number four, cut back or eliminate inflammatory foods. Inflammatory foods include red meat and anything with trans fats such as margarine, corn oil, deep fried fruits. And I know it's Super Bowl Sunday and I know you're going to have French fries. Okay. But anyway, for the rest of the year, deep fried foods and most processed foods. Air frying is a much better way to prepare your fries and your favorite foods. Number five, control your blood sugar. Did you know that food companies have added sugar to many of our common foods to trigger an addiction response? Because they want you to buy more product. Yes, they want you to become addicted. And they have refused to consider the long term harm that their sweetened foods have caused. So limit or avoid simple carbohydrates such as white flour, white rice, refined sugar, or anything with high fructose corn syrup. Opt for whole grain rather than white breads. My personal favorite is Ezekiel bread made by the company Food for Life, which is a much better whole grain choice that is high in protein, lower in carbs, and honestly just tastes great. I had my breakfast this morning was Ezekiel toast with almond butter on it. Number six, make time for exercise. Regular exercise decreases stress, improves digestion, maintains good muscle mass, and bone structure. So every week, try to focus on like 45 minutes of aerobic exercise, 4 or 5 days, and 10 to 25 minutes of weight or resistance training. I will tell you, walking has helped me keep my sanity in the last 8 months because grief is tough. Number seven, manage your stress. Stress has been my middle name for the last few years, especially with the loss of my parents. It is incredibly important that we release stress from our body. I do this by taking walks in my local park, spending time with friends and family, painting, reading, and lots of crafts. I usually love to listen to books on tape each week that are happy and filled with laughter and love. I turn off things that are scary and I turn off things that are sad. And also, just so you know, over on the IC Network website, we've got several free guided relaxation tapes designed specifically for pelvic pain, produced by Beaumont Health. These have been studied in IC research studies and have been proven to reduce pain and discomfort, and they're completely free on the IC Network. And number eight, improve your sleep. 7 to 9 hours of sleep per night is highly recommended. It's helpful to go to bed and wake up at the same time, to sleep in a cool, dark room, and to avoid using your iPhones an hour before bed. This, my friends, may be the most difficult challenge of all for all of us. So, have you ever considered why so many diseases increased exponentially after World War II, especially? And I know some of you are younger and you don't, I mean, I was born in 1960, but my dad was in World War II. So why did diseases begin exponentially after World War II? Well, that's when manufactured foods became established. And we now have to face a reckoning for the toll that they have taken on our bodies and, yes, our minds. If I could go back in time, I wouldn't have picked up all the sodas, the tasty Oreos and Twinkies of my childhood. I'm sure that diet intensified my urinary and bowel symptoms over time. Throw in the wicked levels of stress that we've endured in the past several years due to the pandemic, politics, and war. It's no wonder that many of us are struggling with our health, both physical and mental. So it's time to simplify. I've cleaned up my diet substantially. I'm eating less red meat and many more veggies. As much as I love a good cinnamon roll, I'm saying no to pastries and have chosen not to drink alcohol this year. Dismayed by some weight gain during COVID, I'm determined to stay fit and now exercise 5 or 6 days a week, walking through a local park where I say hi or good morning to everyone. It's nice to see people smiling in return. I haven't watched the TV in weeks other than to check the weather because I refuse to be a pawn of media companies that drive their profits by keeping us all upset. The more upset we are, the more we watch and the more money they make. Enough. And social media is showing its dark side too, as more platforms seek to drive dissension rather than compassion. I'd rather watch a good mystery or read a great book. Actually, I'm really enjoying new adult paint by numbers projects, which are almost meditative for me. And I hope that as the year progresses, we will be able to get back into nature, watching hawks fly. I thought there was a group of four flying right over my house yesterday for quite a while. Listening to the birds sing, getting out in the sunshine, throwing a ball to your children or your dogs, sitting on a beach or by a waterfall is just healing for our bodies, our minds, and our spirits. Okay, so think about this for a moment. I mean, it is true. We are absolutely in a reckoning right now. We have been pawns to so many companies trying to make a buck off of our health, whether it's food, whether it's social media, whatever. And I don't know about you, but I'm freaking sick of it. They don't care about me. They don't care about you. They're just trying to make a buck. And I think that one of the things anybody with chronic pain and pelvic pain that we all have to do is we have to simplify and take away the stressors. Get back to the very, very basics of eating good, fresh, healthy food and of not living our lives online fighting with each other, but getting outside in nature and laughing and working to improve every aspect of our life as much as we can. So when I think about it, and I think about, okay, so remember, my IC began in 7th grade. I had frequency urgency. I developed vulvodynia in high school. I developed IBS in my early 20s, etc. And I know why it happened. I absolutely know why it happened. Number one, I had a bad fall, and number two, I was abused when I was younger. But I really have to wonder: did I perpetuate it? Did I make it worse by? And of course, I didn't know. None of us knew. But I think about what do we often do when we get stressed? We turn to sweets. Sweets trigger inflammation. Inflammation in your bladder gets to your brain. You become depressed. Or if you're just completely clinging to diet soda, I mean, how many patients had drank all they drank was soda when they were younger? I was working with a nurse who for 20 years never drank water. She drank Crystal Light and she had terrible bladder wall irritation. Terrible. And all of her colleagues the hospital she worked at did exactly the same thing. And so rather than a disease process, because we now really realize there's not much of a disease process happening in the vast majority of IC patients, again, we're focusing on this concept of injury or trauma. And we have to look at the ramifications of that long term injury and trauma in the bladder. And I think this completely reinforces why it's so incredibly important we lose the junk food and the fast food and the sodas to calm the bladder down, to calm the inflammation down in the bladder, which will then calm the inflammation down throughout the rest of our body. So I hope that that makes sense. Does that kind of sort of make sense? Kind of, sort of. Um, let's see. Paula says, I'm taking fesoterine and estradiol. Do you recommend for me to add Piora? My back was hurting last week and I took a muscle relaxer and it was credible. I woke up feeling so good, no icy pain at all. Made me think maybe I need to add something that relaxes my muscles. I'm not sure. Well, the proof is in the pudding, hun. If you remember, the great majority of IC patients have tight pelvic floor muscles. Tight pelvic floor muscles cause ischemia. They squeeze blood supply, they squeeze nerves, and they cause more pain. So we absolutely want to address any muscle tension that's there. And so if I were you, I would number one, ask your doctor to refer referral to a pelvic floor physical therapist so we can find out once and for all what's going on with your muscles. And number two, doing a muscle relaxant when your muscles get tight makes sense. But we don't want to just chase the symptoms with medication. We want to fix the underlying problem with the muscles. And that's why physical therapy and your ability to do any internal work at home with a wand is really important. So I would absolutely, I mean, listen, you felt better with a muscle relaxant, your IT symptoms went away. That's classic. And that what that tells me is that you are probably pelvic floor driven. So go get your muscles checked and see what happens. Anne says she's struggling with flare that's causing burning and frequency. What would be my next step? Does a pelvic floor therapist help with flares? Yeah, they did. If your flare is coming from tight muscles, getting to a pelvic floor physical therapist to check out those muscles and tell you what's going on with them is important. Is a hydrodistension with cystoscopy the last line of defense? Absolutely not. Hydrodistension has no role in long-term flare management at all. A hydrodistension is diagnostic, and if you choose to do it as a therapy, it's not going to fix anything. It's what I call a destructive therapy because it temporarily breaks the nerves, but the nerves always grow back and the pain will always come back. So rather than thinking that a hydrodistension is the right treatment, it's not. It won't get you anywhere other than maybe a couple of months of no pain, but the pain will come back and sometimes even more nerves grow back than you originally had. So we got to instead try to figure out what's driving that flare in the first place. Is it a bladder wall flare? It's a pelvic floor flare. The IC Network has a 40-page flare management guide that you can get for free if you go on over to the IC Network website and just sign up to get our free newsletter. Elizabeth says she was just told on Friday it is incurable. Well, we don't believe that anymore, Elizabeth. We don't even think IC is a bladder disease anymore. The brand new guideline, American Urology Association guidelines that came out last year in 2022 absolutely says that no disease process is happening in the bladder wall in the vast majority of patients. Why? Why do you have symptoms and yet you have no disease in your bladder? Well, now we know that the bladder doesn't operate in isolation, that there's muscles that influence the bladder, there's nerves that influence the bladder, there's blood vessels that influence the bladder. And then if any of those get screwed up, you're going to have symptoms that are suggestive of IC or symptoms that are suggestive of a UTI. That is why in our new guidelines, every patient suspected of having interstitial cystitis should, at their very, very first appointment, have their pelvic floor muscles checked, and they should be referred to a pelvic floor physical therapist immediately if their muscles are funky. All right, because muscle therapy works. I mean, we knew 15 years ago the pelvic floor physical therapy was far more effective than any of the other treatments. Why? Maybe it's not a bladder disease in the great majority of us. Maybe it's actually a muscle issue. And now we know that 85% of IC patients actually have an underlying neuromuscular disorder that's related to nerves and muscles. I did bladder therapies for decades. It never worked for me. I am now symptom free because I've done proper pelvic floor muscle work and I've calmed my nerves down. Jan says, I found a herb quite by accident that eased the cramping type pain and it helped relax my bladder. Typically, that just does not happen. I took it for 2 weeks. The herb is marshmallow root. Yeah, we've had marshmallow root for many, many years now. You can actually get it in the IC Network store. It kind of acts to coat the bladder. It doesn't fix anything, but it can be very calming and soothing during a bladder wall flare. Hold on one sec. Anne says, well, how does a pelvic floor therapist help with flares? They get your muscles out of tension. Hi, Boria. Kayleen says, I just picked up Vistaril and I ended up getting COVID tests. Okay. Hydrodistension was horrible. I was in pain 3 months after, but also had a bundle of endometriosis sitting in my bladder. Yeah. Aaron says, is it true that though that not every case of IC is diet related? I know diet is everything for me. I have IBS also. So Aaron, the fact that you have IC and IBS puts you in IC subtype 5, central sensitization, widespread pain, which means that you are being driven by a very, very sensitive, injured nervous system. The nerves in your bladder are very sensitive, and the nerves in your bowel are very sensitive. And if you have any other pain conditions like vulvodynia, TMJ, migraines, fibromyalgia, etc., that absolutely confirms it. How do we know you have a very sensitive nervous system? Typically, for those of us in this subtype, we have very sensitive skin and we have an amazing sense of smell. We can smell things that other people can't smell, and smells tend to drive us crazy. We also struggle with anxiety disorder. Anxiety disorder is also a sign that we have a very, very sensitive, injured nervous system. Anne says, how do you tell what a flare is coming from? By your symptoms, hon. I've gone over to the IT Network website and sign up for our newsletter, and you can download the flare management guide. That will tell you everything you need to know. And Aaron goes, yes, that's me. I know. Isn't it great? You can finally talk to somebody who gets it and who has exactly the same thing. It's like the best part of my job when I get to talk to patients and we phenotype them, and you have so many of you have exactly my phenotype. You've got tight, injured pelvic floor muscles, and you have a very sensitive nervous system. And bladder treatments don't work. They might give you a little bit of symptom relief, but they'll never fix it. We have to fix it by restoring proper blood supply, by getting those pelvic floor muscles correct. And we have to physically calm nerves down. Now, okay, guys. Okay. So the second thing that we have to do is I have to introduce a new product line. So you know what? Got Valentine's Day, 3 days away. Valentine's Day, 3 days away. I don't know about you, but I cannot eat chocolate. I can't. It's like poison in my body. I get the worst spasms. Wherever it is, my bowel goes like this. My stomach, as soon as I eat it, my stomach goes crazy as it moves through my small intestine. And then finally, when it hits my large intestine, I am laying on my bathroom floor. The pain is so bad. So I have not eaten chocolate legitimately since my 20s, 30, 35. Yeah, 35, 36 years ago. Chocolate is a trigger. Number one, it has caffeine. Number two, it's very allergenic and it's known for triggering migraine. But what do you do on a holiday where chocolate is the norm? Carob. Carob, my friends. Carob is wonderful. It's not the carob that we knew 40 years ago that was very dry and icky. The new carob today is almost identical to chocolate, but it does not have the allergenic properties. So we carried for many, many years a company called Mitzi J's. We have carob cake mix, we had carob brownie mix, we had candy bars, etc. Everybody loved those. That company was sold, and unfortunately now we just really can't get it anymore. So I found a new company called Aussie Shark Bar. So there's a caramel corn. The one I had, I've been slowly eating one over the last week. Oh, like I just really should not keep any of this in my house because I cannot stop myself. I won't eat the whole thing. And luckily, this is so rich and so flavorful. After you have a couple of pieces, you don't want to. So you got to really enjoy it. So I wanted to do a really quick test. So we're going to open the Shark Bar. I've been eating the Crunch Bar, and the Crunch Bar is to die for. So let's open the caramel corn, and let's see. So just so you know, it looks just like a chocolate bar, right? And it's really not that. There's not too many calories on it. Ironically, with us just talking about reducing sugar, there's not a lot of sugar in it, to be quite honest. 260 calories for 10 pieces. So here, let's see. I haven't tried this one yet. Let's see what it tastes like. Oh my god. Oh my goodness. Oh my goodness. So good. You got this undertone of this rich, flavorful carob that's just almost identical to chocolate. And it's really light caramel flavor. Heavenly. Heavenly. Oh, okay. So, like, I don't know about you, but after dinner, my body does not know when to stop eating until I eat something sweet. This meets that goal. Couple little pieces of this after dinner. Perfect. This is USDA organic, non-GMO, gluten-free, soy-free, and vegan. And let's see, 260 calories for 10 pieces. I just ate 2.5 pieces, so what? 60 calories. It's no trans fat. Obviously, there's some saturated fat, very low sodium, and just a little tiny bit of added sugar. Had some iron, had some potassium in it. So if you need something just a little sweet, but we're not over the top, downing lots and lots and lots and lots of sugar, this is the way to go. I promise you, you'll love it. Aaron says, yum, do you have to order this carob candy online? Yes, it's in the IC Network shop right now. So it's called Aussie Shock Shark Bar. They also have semi-sweet carob chips and unsweetened carob chips that we have. And we also have carob-covered nuts. We have carob-covered cashews, carob-covered almonds, and carob-covered peanuts. But the expiration date on the nuts is very, very quick. You got less than a month. So if you want to try the nuts, you got to order them right away. And just know that nuts expire really, really quickly. So you're not going to be able to hold on to them for months. You're going to eat them as soon as you get them. So anyway, if anybody wants to try any of these new carob bars, they are fabulous. I love them. Love, love, love them. Okay. Now, the last thing that I want to talk about before we dive into your questions is actually the theme of the day. I'm wearing pink. Why? Because hello, it's Valentine's Day. We're going to have Valentine's Day this week. And I prepared a little something for you. So hold on a sec. Where did it go? Where is it? Where did I put it? Here it is. Okay. So when you have pelvic pain, number one, you don't feel well. Number two, you're not sure what to eat or drink, which takes out, getting a box of chocolates for Thanksgiving. And you're not sure if you're going to be able to have sex or not, if you even want to have sex or not. I mean, my first 2 years, I was like, get the hell away from me. You're not touching me with a 10-foot pole. I was in so much pain. Of course, I didn't know why I was in pain. Now I know my muscles were very tight. So Valentine's Day is definitely one of the hardest Valentine's Day for IT patients to get through. And I had prepared a little bit of info on that for you too. Okay. So the spirit of Valentine's is love. If there's one day that's expected to generate performance anxiety, it's Valentine's Day. Some think that Valentine's Day is supposed to be a big emotional, physical expression of love and adoration. Others resent the over commercialization of the holiday or expectations that their lovers may have of them. And still others may have been so hurt and disappointed by a previous Valentine's Day that they simply can't enjoy the day fully. In fact, I had the worst breakup of my life on a Valentine's Day. So Valentine's Day is just a wee bit hard for me. Regardless of where you stand on the holiday, it is important to remember that the spirit of the holiday is to express your love with your partner and your friends and to say, I'm glad that you're in my life. The monkey in the room is clearly sex. It's no secret that intimacy can be uncomfortable for pelvic pain patients, particularly if you're in a flare. How a couple handles those moments when one person wants to have sex and the other doesn't or can't is a true sign of their maturity and strength. After all, we're really not going to expect someone to have wild, passionate, athletic sex when they have a broken hip. Neither should we expect the same from someone who's having serious pelvic pain. Dr. Heather Howard, who runs the Center for Sexual Health and Rehabilitation, has 2 free guides on her website that can provide some valuable tips, helpful tips on how to reduce sexual pain, a new way to look at sex and reducing sexual pain, a guide for couples. And you'll find this blog right on the IC Network website right now, and I've got links to that. But there's a little bit more. So, question number 1, to do it or not to do it? If your IC is in remission and you're feeling good, then by all means enjoy intimacy. You'll find several tips and suggestions on how to make sex more comfortable and enjoyable in the ICN Romance and Intimacy Center. Over on the IC Network website. If you're feeling uncomfortable and not prepared to have intercourse, that doesn't mean that you can't express your love with your partner in different ways. You might consider pleasuring your partner or trying some tantric sex, also known as outercourse. Some couples use toys like the Tenga for moments when penetration isn't possible. A woman can simply hold the toy between her legs or in her hands. Sound weird? It really isn't. Many couples love this sex toy because it's playful, fun, and very satisfying. And I got to tell you this. So, this was like 20 years ago. We were all sitting around the meeting room going, what do we do when intercourse is painful? Surely there's something that can help. Surely there's a sex toy that a man can use to thrust into when a woman cannot tolerate penetration. And so we got online and we found the Tenga. And the Tenga is like the Japanese aerospace industry meets the sex toy industry in Asia. And it's fabulous. The Tenga flip hole is amazing. And so what we did is we bought about a dozen of them and we passed them out to couples around the country and asked for their feedbacks. Like, hey, here's something new. If sex is painful, you want to give it a try and tell us what you think? Rave reviews. Rave reviews. So sometimes we have to be just a little bit creative. But if you're in a serious flare and you feel quite poorly, then of course intimacy is out of the question. But don't you both deserve the warmth of a hug, a warm shoulder, or just the presence of someone you care for? How about finding a favorite movie on TV, some icy friendly snacks, and just cuddling on the sofa or in front of a roaring fire for a few hours? I mean, it's still winter. Turning no to sex into yes for love is important. If you're the pain patient and saying no to sex, you have to understand that your partner could be hurt by your rejection. And of course, that's the entire point. This is not a rejection of the love of your relationship. You have to work hard to make sure you communicate that clearly with your partner. It's all about how you talk to each other and communicate during these quite vulnerable moments. You might consider saying, tonight, my love, my pelvis is tender. I'd like to wait until I'm feeling better so that we can both enjoy this moment. So I'm not saying no to you as my partner. I love you deeply and passionately. I'm just saying that right now my body is just too fragile. And follow that up with hugs and kisses. Express yourself clearly, look deeply in their eyes, and say, I can't change my love for you. I love you very, very much. Now, if you're the partner of somebody with pelvic pain, try to remember that they feel very insecure and vulnerable. Don't push them when they aren't feeling well. But of course, that's often the hardest part because you might not know how they feel. When in doubt, ask them, honey, how are you feeling today? Is there anything that I can do to help? Perhaps a shoulder massage, a heating pad, a foot rub, or making dinner? And of course, there are times when the person who is ill or injured just might need some quiet time and sleep. And if that happens on Valentine's, then let it be. It's okay. Like Christmas, Valentine's Day is still just one day in our lives, and there will be many others where you can express your love. Now, I apologize if this offended anyone, but we do on occasion need to talk about intimacy and how pelvic pain can impact that. For those of you who know me, you know that I'm very direct about the issues we struggle with. I believe that we can strengthen rather than weaken our relationships if we face these issues head on. We can't hide from the fact that there are times when we might be feeling unwell, nor should we hide from how pelvic pain can influence how we feel. But on special days like Valentine's Day, there can be preconceived notions and expectations that could rob us of the love that we so richly deserve. So please remember that IC cannot change your heart, nor the love that you can give to others. Love is much more than just sex. It is a daily expression of kindness and caring too. All right, so that's my little blurb on Valentine's Day. In other words, if you feel good, go for it. If you're looking for some tips on making intimacy more comfortable, we have those right on the IC Network website in our Romance and Intimacy Center. If you are not up to it, that's okay too. But make sure your partner understands that you're not saying no to their love. Reinforce that you love them. Reinforce that that does not change. Tell them right now, my body says no. But when I'm better, we're going to have some fun. And sometimes, Valentine's Day just gets too big. That's why I broke up with my fiance. I sent him this giant box of homemade treats because he lived in another state. And I had a picture taken of me. He hadn't had any pictures of me for quite a while. I send that off to him. Nothing. Not even a phone call. He was a police officer. God rest his soul. He has since passed. And when we finally connected, like the next day, he goes, "Jill, you just shouldn't get your hopes up." And I'm like, "What did that mean?" And he broke it off. I was last night not working. I was with a couple of friends, and we were playing Fortnite when one of our friends came in who had just gone through a very, 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 very devastating breakup. And I think that we have to remember that, especially when you're younger, um, it feels so big and it feels so important. But every relationship feels that way at the beginning. And it's actually really rare that you fall in love with and marry the first person that you go out with. That's actually pretty rare. It happens, but it's pretty rare. For most of us, we have to go out with several people as we try to decide, what do we want with our lives? Who do we want to be with? What do we want our homes to be like? If you're a clean person, are you going to marry somebody who's very messy? Probably not. Do you want a partner? All this sort of stuff. And so, as somebody who's been through the worst of the worst on Valentine's Day, I just want to remind you that there's hope. And sometimes the best thing you can do is just take a step back and give yourself some love and give yourself some comfort too. Ultimately, in the end, it's just a day. Go out. I bought myself those flowers yesterday. Absolutely. Go out and buy yourself some flowers. Okay, that's it. You've got my little blurbs for the day. So let us go back to your questions. And let me get a drink here real quick. What am I drinking? Hot water with a little tiny bit of lemonade. Because I can drink lemonade now. Go figure. Why? Because it was never my bladder. It's always been my muscles. And once we got my muscles relaxed and blood flow restored to my bladder healed. And now I can eat or drink all the risk foods that I couldn't drink for so many decades. All right, hold on one sec. Val said that was her too, the whole widespread pain thing. Exactly. Carolyn said, I didn't have pelvic pain until after this procedure, after the hydro, was it after a hydrodistension, Carolyn? I have to scroll back to see if I can find your note. Trauma is real. The bladder can be injured. The bladder absolutely can be injured. It can be injured as a result of surgical procedures. It can be injured as a result of overstretching the bladder with a hydrodistension. That's why our new guidelines basically say let's not do a hydrodistension unless the diagnosis is in doubt. The theme of our guidelines is reducing trauma. Back in the old days, 10, 15, 20 years ago, they thought the more you stretch the bladder, the better the result. Of course, when you overstretch the bladder, bad things happen, like the bladder rupturing. So a lot of patients back 20, 30 years ago who had a hydrodistension got much, much worse afterwards because it actually injured them. And so today now, if a hydrodistension is performed, it should be done at a very low pressure, very short duration to minimize any trauma to the bladder wall. So if you had a procedure more than 10 years ago, yeah, you were hurt. But now everybody acknowledges that we don't want to do that anymore. Urology back in the day was very macho. They just kind of thought the more the better. Now we know that's not the case. Now we're trying to repair the integrity of the bladder wall. We don't want to aggravate it. Back in the old days, they used to strip the bladder wall off, assuming that IC was a problem with the bladder wall. And if you removed it, a new healthy bladder wall would grow. Now we know that's utterly stupid. It didn't mean that they had great intentions. They really wanted to help. But now we know that the last thing we want to do is injure the bladder further. So we're really trying to minimize trauma. Peggy said, a bladder showed a coarse stone. The Euroscan did not show this. How is this possible? It can be the composition of the stone, what it's made of. Some tests might find it and some might not. My urogynecologist will perform an in-office cystoscope to see what she can find. All this started 9 months ago after having severe low back pain and an increase in bladder pain. Different from the IC pain for the last 20 years, I exercise, drink 32 ounces of water every day, no coffee, soda, eat a very healthy diet. I did the pelvic floor exercises 6 weeks back in October, did not help at all. I started PEA 500 twice a day for 6 weeks. Hasn't worked yet. Discontinued Elmeron 1 month ago. I really do think there's a stone in my bladder. What can I expect from a cystoscopy in the office? Not being put out for it. That should be a really easy test, honey. It's what I call a looky-loo. All they're going to do is numb your urethra, stick a scope in, take a look around, pull it out. If you've got a bladder stone, they'll see it. So having the cystoscopy itself is certainly not terrible because they're not stretching your bladder to any great degree. They're going to numb your urethra, and when they stick the scope in, that stretches the urethra, and that can cause pain in the urethra. But with that topical lidocaine, that's greatly minimized. And I think really the only legacy pain associated with the cystoscopy is you peeing afterwards. The first couple of times you urinate after a cystoscopy or after having a catheter put in your urethra, your urethra is very sore at first, but that goes away very quickly. But the first couple of times you urinate are not going to be fun. I had about 100 urethral dilations back in the day when I was in junior high and high school, and that's awful. I mean, they stick a metal wand in your urethra and they stretch it. I mean, deliberately stretch it. I remember they numbed my urethra, and I wore a laughing gas And I breathed that in like mad, and then they did it, and I went, "Ow!" And then they were done. Um, and Back then, they didn't think to ask, "Gee, why is your urethra narrow?" "Oh, why?" Because she has very, very tight pelvic floor muscles. We have to practice a lot of forgiveness because back then they didn't understand that. Back then they didn't understand that a hydrodistension with cystoscopy has the potential of damaging the bladder if you do too much of it. But we're learning. The medical community is learning. Everything is getting better. And isn't that our job? Isn't our job right now, every single one of you listening and watching to this, isn't our job to make it better for the next generation? And that's what we're doing. That's what we're trying to do is by educating patients and by educating doctors and making sure they read those guidelines so that they know that they should not be doing high pressure hydrodistension. Honey, I don't want you to give up on pelvic floor. You got to have a reality check here. You have to be very, listen, pain is coming from one of three things. Well, four things. Number one, pain can come from your bladder wall, pain can come from muscles, pain can come from nerves, and pain can come from blood vessels. That's it. That's it. And so I know you did 6 weeks of pelvic floor physical therapy. The question is, what is the health of your muscles? Are your muscles still tight? Because if your muscles are still tight, then either you didn't have the right therapy, they did not do the internal work like they should have, um, or you have something else happening that is keeping your muscles tight, like a bad SI joint, like I have, or a broken tailbone, or a bad knee, or even a bad foot. How your foot hits the ground, all that pressure, all that, um, what's the right word? Not torque. All that pressure is reflected directly back up your legs and into your pelvic floor. So if you have an ankle that rolls in, an ankle that rolls out, that's going to tighten your pelvic floor muscles. If you're pigeon toed, that's going to affect your pelvic floor muscles. If you're duck footed, that's going to affect your pelvic floor. So don't assume they're not helping because you're not necessarily going to feel a quick change in your symptoms for some of these. It's a slow and steady improvement in the quality and health of your skin and the quality and health of your muscles. So, if, for example, when you go to urinate, you can't start your stream right away and you're still hesitating 5, 10, 15, 20 seconds, or you have to strain to empty your bladder, or you have sciatica, or you have a lot of pain and flares when you're in a car, honey, that's all driven by the pelvic floor. And so we've got to get back and understand what's going on with that pelvic floor. And for many of us, 6 weeks is nothing because there's been pelvic floor muscle dysfunction for years and years and years. So the most important question to ask that pelvic floor physical therapist is, are my muscles responding to therapy or are they always going back tight? If your muscles are always referring back to tension, then we've got more work to do. We've got to figure out why those muscles are going back down into tension. So this is why, Peggy, we phenotype, because we want to try to figure out what group you fall into. So you went to a pelvic floor physical therapist. They gave you 6 weeks of therapy, which means that they found something. And I still want to know how your muscles are. You still need to know how healthy those muscles are. Because if they're not healthy, you're in a state of ischemia, your blood flow is reduced to your bladder, and that's why your bladder wall becomes so sensitive. All right. Kayleen says, right after I woke up from the hydros, I was screaming in pain. It felt like someone took my bladder and stretched it like a rubber glove. It felt scraped from the cystoscope too. He writes on the bladder installation notes, patient received little relief from this as well. I'm not sure what you were referring to, Kayleen. And here, I got to stick my sweater on, it's a little cold. Paula, I think says, I think I know exactly what caused my IC stress and energy drinks. I was drinking 2 Red Bulls a day. I wish I could go back in time. I will make sure my daughters don't make the same mistake. Yeah. Yeah. Energy drinks are when we did both I did it and then the IBS community did it, where we all did surveys on what we thought the most bladder irritating drinks were, and energy drinks were absolutely the single worst drink you could drink for your bladder and your bowel. All right, hold on a sec. Hold on a sec. Anne said, so what doctor should I see for flares? I don't think the urologist can help. Um, you know what, Anne, you should call me. Would you call me this week and let's just have a discussion about this, okay? Because I think you're, and now a lot of people call the IC network and they go, I can't find a doctor to help me with this. And the reality is that there's really only one or two doctors in the world that can do all of this. So the reason why we phenotype is to try to find the underlying issue, because if we can find the underlying issue, then we know which doctor to send you to. So if, for example, your underlying issue is estrogen atrophy, let's just say your symptoms began as you got older, went through perimenopause, or after you had a total hysterectomy. I got to tell you, I was working with a patient who'd had a hysterectomy 25 years ago, and her skin was dry as a bone. And she was having terrible bladder issues, and she didn't know why. She did not understand that the loss of estrogen from losing your ovaries directly affects your bladder wall. So, if we've got somebody where it's suggestive of estrogen atrophy, you're going to go to a gynecologist. If you're straining and straining and straining to pee, really, we want to have that pelvic floor muscle assessment to see what's going on with those muscles, because you may need to just work with a physical therapist. And if those muscles are not responding to treatment, you may need to go see a physiatrist or an orthopedic surgeon. We got to look at bones because bones affect how muscles behave. If, on the other hand, you've got blood in your urine and you have severe pain on bladder fill, then we're going to go to a urologist so that they can rule that stuff out. But this is exactly why we do phenotyping, to help you find really the most effective doctor for your unique case. Hi, Gay. Elizabeth says, what if we haven't had a trauma? Would it still be our muscle? If you've had children, if you sit for a long period of time at work, if you were an athlete, a runner, if you were a younger athlete, if you were gymnastics, ice skating, anything like that, if you've been sexually abused, those all could cause tight pelvic floor muscles, but just sitting for long periods of time. Sherry says, I just ordered 2 packages of Aussie bars. You're a great salesperson. Good. Sherry, I promise you, you're going to love them. You're going to love them. And what I should do is give this away so I don't have this in my house, because I will nail it. All right. Yolanda says, the 2 scopes that went through the urethra, they never used numbing cream. Doctor did say the urethra was turning on the tip. So the tip was curved. So either your urethra was curved or the cystoscope itself was curved. I'm a little unsure. Urethras can be skewed to the left or right, especially if you've got the start of maybe a prolapse. Your muscles are very, very weak. If you're not being held in place properly, that's a possibility. Lisa said they just numbed only the urethra when I had the stretching, no laughing gas. It was excruciating pain many, many times. Yeah. Hi, Paula. Elizabeth says she has more of a burn than anything. So, Elizabeth, where specifically is the burn? Is the burn on your skin on the outside when you urinate? is the burn in your vagina or is the burn in your urethra or bladder? Tell us where that burn is. Angel's having her surgery tomorrow. Oh, good luck, honey. Good luck. Keep us posted. We're sending lots of good healing vibes to you right now. You got this. Orally says, I have a question regarding gravity fill hydrodistension to 110 cc's under anesthesia. Is this safe to do? Is this safe or okay by a provider to do? Orally, the way we would answer that question is by going right back to the AUA guidelines. Let me see if I can give you a direct answer to that because I don't have that memorized. So let me see if I can find that for you. So what I'm doing is I'm going over to the American Urology Association website. I'm clicking on guidelines in the main menu. Then I'm clicking on non-oncology guidelines, non-cancerous. And no, I'm going to interstitial cystitis, read it online. And I'm just going to do a search of the page for the word hydrodistension because it's a long document. Okay, cystoscopy under anesthesia with short duration, low pressure hydrodistension may be undertaken. All right, so let me go through this. Let me see if I can find it. High pressure should not be done. Okay. Hydrodistensions methods vary widely. Duration, pressure, and the number of hydrodistension episodes per session vary greatly. Given the differing approaches, the finding of glomerations on hydrodistension, which is less than 80 centimeters of water for less than 5 minutes. So 80 centimeters of water, less than 5 minutes. So I'm going to give you a link for this. Orally, I'm putting a link right now in the chat. You can go find that there. So 1100 cc's under anesthesia, that seems very extreme. We could dig for some more data on that too. Hold on. Let me just see if there's anything else out here. That's guideline statement 3 in the AUA guidelines. So hold on a sec. Let me go to the not recommended and see what they say, how they classify a high pressure. Here we go. So a high pressure, long duration hydrodistension is greater than 80 to 100 centimeters of water for greater than 10 minutes is associated with increased frequency of adverse events like bladder rupture or sepsis. This is based on 3 observational studies that used high pressure, long duration, all reported at least 1 case of a ruptured bladder. Okay, that's guideline statement 25. So you're going to need to qualify that. They've told you 1100 cc's. You're going to have to compare that statement with what the AUA guidelines say and have your doctor clarify that. Because 1100 cc seems pretty extreme for a hydrodistension. Okay. Lisa said, I've had many therapy sessions, physical therapy, and they want you to do Kegel exercises to tighten. Yet also say your bladder needs to be relaxed for your IC to be better and have less flare-ups. I still to this day, and have had installation, so many other procedures for years, since 2007. So, so Lisa, the great majority of us have tight muscles, and Kegel exercises hurt. We are told very specifically not to do Kegel exercises. And in fact, the AUA guidelines say that not to do Kegel exercises. Because the last thing we want to do is over tighten muscles that are already too tight. Instead, when we have physical therapy, we are focusing on relaxing those muscles. So, so there's something called a quick flick. A quick flick. So when you do, I mean, look, we can do a Kegel right now. Okay, I'm going to do a Kegel right now. Okay, so hold on. I am magically, okay, I'm doing it right now. Okay, so I'm pulling out my pelvic and I'm tightening it and then I'm letting it go. Okay. If you struggle with incontinence, you spend your time on the tightening phase. You hold it tight for a couple of seconds. Okay. That's the opposite of what we normally do. What we will normally do is tighten it briefly and then focus on the relaxing part of it. And it's interesting. I can remember when I had my very first pelvic floor assessment. My physical therapist, Karen Kurtovich, this was quite some time ago. She had her finger in my vagina and she said, "Do some Kegels." So my first Kegel was perfect. I could tighten and I could relax. My second Kegel, I could tighten and relax. My third Kegel, I could tighten, but I couldn't relax. It got very, very slow. And that told both of us that my muscles were not very responsive. And the other challenge we have is, why do muscles get tight in the first place? Well, sometimes muscles get tight because the muscle is weak. So if you, for example, had a baby and you suffered a muscle tear, and that muscle tear has healed to the best of your knowledge, but that injury is still there. And with that injury, um, especially if there's a trigger point, that muscle gets weakened, and then it still has a job to do. So it gets overly tight to compensate for the weakness. So therapeutically, what they will do is they will first work to relax the muscle. We got to get the muscle out of tension. Once we get it out of tension, then you can start with the strengthening of that weak muscle. And it's interesting what can affect our muscle health. So our muscle health can be affected by diet. Our muscle health can be affected by estrogen. Our muscle health can be affected by injury, and our muscle health is directly affected by what we do. If we sit too long, that's going to weaken muscles. And if we run too far, that's going to be damaging too. It's always a bit of finding the right balance for you, not going to any great extreme. We don't want to sit for long periods of time, nor do we want to run aggressively every single day. A lot of you may not know that some of those super, super marathoners that are running in the Olympics have to run with pessaries because their workouts have massively weakened their muscles and things are starting to fall out. So what they do is they stick a pessary up in their vagina, which helps keep everything in place, and they compete with those. So there are consequences to the decisions we make in life, whether it's food, whether it's exercise, et cetera, and then we've got to throw in injury. My muscles have been, for the most part, very responsive to therapy. My left side continues to stay fairly tight because it's compensating for my SI joint. But I'm older now. And the loss of estrogen doesn't just change skin health, and muscles tend to get weaker. Now, I never leaked. The only time I really ever leaked badly was when a dog attacked me and I fell down and I just wet my pants. I just wet my pants. Who wouldn't at that point in time? Um, yeah, it was a neighbor with an out of control German Shepherd who was going for the cat that I was carrying. And anyway, it was just this whole bugaboo in my neighborhood. It was very, very disappointing. And I just lost it. I fell and I peed. Um, and that was really the only time that I'd ever really lost it, except I can remember as a child laughing too hard and occasionally leaking. But as an adult, not really. Until I got COVID. And the coughing was so violent last May that I actually leaked. And I was stunned. I was absolute I mean, not a lot. It was just like a drop of urine in my urethra, but I damn well felt it. And, that's when you run to the bathroom and you go, "Oh my god, there's gotta be a puddle underneath me," and there's not. It's like a little tiny drop of urine, but it's hit your underwear and your underwear is slightly wet. And that it happened again when I was walking. So I wear mini pads now when I walk, and I just really think that I massively strained my pelvic floor coughing, and my muscles are a bit weaker now. It is what it is. And the phone number is right on the top of our website, and it's right back here too. And guys, please know that I work with patients almost every day. Except Mondays are normally my day off. Um, it's first come, first serve. If you call and you get me, for God's sake, use me. Use it. Because a lot of times I'm just super, super busy and I won't be able to return phone calls until later that day or even a couple of days later. So feel free to call. I'm always happy to talk with you. But at the same time, understand that and this is a very busy week for me, just so you know. Uh, yeah. So I have physical therapy for my neck on Tuesday. I've got a big meeting on Thursday with our new guidelines. Um, so I'm really only going to be available Wednesday and Friday. Okay. Hello, Sue. Sue says, my physical therapist told me you shouldn't blow your nose while you sit on the toilet because it can weaken your pelvic floor muscles and cause weakness, and a lot of women do that. I don't think I've really ever done that before, but I think coughing would do the same thing. I mean, and the coughing of COVID is so violent. It breaks my heart that literally I had to cut short my second to last visit with my mom as she was dying because I was coughing so violently I could barely breathe. And she was in a private room. Well, no, it wasn't a private room because my dad was in the room with her at the time. But I had to run into the bathroom and I couldn't stop coughing. And I just had to run out of the hospital. And that would have been the last time I could have had a good discussion with her before she passed. Damn COVID. Donna says, I have bladder rest and allopath. How do they differ and when should I use one? Bladder rest is a chondroitin-based supplement and it helps to kind of coat the bladder wall. That's more of a protective coating effect. So that's kind of the long-term effect. If you have estrogen atrophy, for example, having a little bit of bladder rest on board daily makes sense if you've got a vulnerable bladder wall. In contrast, the bladder is soothed by aloe. So a lot of patients use aloe path for flares. So remember, the bladder's not made of aloe, so aloe does not have what I call a constructive effect of the bladder. Aloe has more of a soothing effect on the bladder. So just as aloe is soothing to a sunburn, aloe can be soothing to a tender bladder wall. So you can save that one for flares, and the bladder rest is the one that I think makes the most sense as more of a helping to handle estrogen atrophy over time. Lisa says, I don't know if it's age or years with IC, yet I stand up or jump or gag or sneeze. I will leak a bit. So I was told to do Kegels to help with that. And I'm taking trospium 60 milligrams in the morning, now 20 milligrams at night, just so I don't have to get through the night. And I stopped it, went to natural products, and I had flare ups and a lot of pain. Yeah, because a lot of the natural products out there are really designed by people who don't understand what IC is, and they're going to have a lot of citric acid in it and irritants in it. And so, I mean, leaking is a muscle issue. So, doing something like physical therapy to get those muscles healthy again make the most sense rather than doing an herb. Sue says, I need prayers and strength. My mother's cancer is back, and it's, oh, honey, I'm so sorry. I'm so sorry. Life just sucks sometimes. And, you know, I I have always considered myself very well adjusted and very calm and very balanced and strong. And I thought that, and I have no regrets, none. I'm so proud of what I did to care for my parents for so long. And I paid a price for it, let me tell you, in my own health. Being a caregiver to two very elderly parents is very rough. They came in and they would come in that door right there. So many of you met them, my dad and my mom. I don't think I understood how that loss would feel. It's it's so hard. My mom's birthday was the 8th, and I just cried all day, just a couple days ago. Um, and yet here we have this monster storm. It's really scary storm here last weekend, which is why I didn't stream last weekend. And power was out, everything it was out, and I went, oh, thank God I don't have to worry about my parents right now. They've gotten them through all of those disasters and fires. So, Sue, honey, you just love on her as much as you can. No regrets, love on her as much as you can, and just know that spirit is real. And I feel my mom all the time. I feel my dad all the time. I have no doubt that they're close. In fact, I signed up, I bought tickets to go see Tyler Henry in May. I'm quite excited about that. Um, but it's a journey, honey, and I'm sending you lots of strength and lots of love. And if you need to talk, you can give me a phone call. I would love to be there for you because I consider you a dear friend. You're not alone, hon. What do they say? The worst thing a parent can do is to bury a child, and that's absolutely true. The worst thing a child can do is to bury a parent too. And I think we just have to handle life with grace. Life happens. Sue says, I'm going back to therapy because I need to set boundaries to protect myself because I was so over my head last time. Yeah, hon, you need lots of help because it's not all on you. It's not all on you. It's not your job to do everything. And that was like a big lesson for me. I did everything for 50. I did not have a night away in 7 years. And I realize now how damaging that was to me. That's why I got diagnosed with high blood pressure last year. And ultimately, you know, we have to live our lives. And I think if you can look at yourself in the mirror at the end of the day and be proud of what you've done that day, that's a good day. That's a good day. But it also doesn't mean that you have to carry the burden of other family members. You've got to be very firm and aggressive with your other family members and say, I can't do it anymore, guys. I can't do it all. This is your last shot. Mom has cancer. She's got bad cancer. The outcome is poor. This is your chance to make her final days a joy. Be here. Do it. I think that that's the one thing that I had some anger over. I just a little bit of anger left over, and that is that, like on my mom's last birthday a year ago, nobody came. She didn't get cards. She had me. My sister sent flowers, but nobody called. None of the extended kids made any effort to reach out to my mom. And it was her last freaking birthday. So take the time to treasure those days and fill them up with love. Love conquers all. Donna says, my mother's still alive at 92 and we don't speak. I think how wonderful it must be to love a parent and parents so much. It gets back to ultimately, we all have to live our own lives. And with each generation, we get to look at how we were treated and decide if we want to continue that or not. And there are many, many instances where we have children who have gone a different direction and parents who resent it. Children who have married somebody that their parent didn't like. Children who changed their religion. Children who changed their political party. In the end, this is your life. It is not their life. It is your life. And you get to live the life you choose. And if you have somebody in your life who is being abusive, if you have somebody in your life who's making you feel bad, you have the right not to be there. And there are some circumstances where you have to just split up for happiness. And all you can do is just send light and love. Just send light and love. I know that on the other side, forgiveness is real. And there may be an opportunity to mend those differences. But at this point in time right now, if we can't mend those differences, it's okay. I have in my family, a branch of my family, distant family that married my aunt married a man who I think in the end was quite abusive. And he was extremely abusive to my cousin. I mean, I was there, I thought, I witnessed it. Demeaning, insulting, yelling, screaming. She was allowed to buy gifts for her sons, but not her daughter. That's how bad it was. And of course, none of us really knew that at the time. We didn't learn about that until later. And I can remember after she grew up and I was talking with my cousins, and I just said to them, I said, listen, you have the power to make change here. You don't have to live that way anymore. And you don't have to let that perpetuate to your children. So look at how your parents treated you and ask yourself, what would I do differently? And then do it differently. You can do it differently. What would I do differently in my childhood? I would have moved schools because that's where I was attacked. And if there is one thing that I think that should have been done that was not done, And I carried a lot of anger over this for years. I really felt like they didn't listen to me. I think if we could have gone back in time and transferred me to a school where my abuser was not at that school, I think things would have been a lot easier for me. And I don't think I would have developed widespread pain. But they didn't know. I didn't know. Forgiveness is real. They did the best they could with what they had. I did the best I could with what I had. And ultimately, in the end, we can't live in the past. We cannot keep reliving bad things that happen to us that gets us nowhere. It happened, it's over, it's done. Yes, I was attacked badly in fourth grade, but it's over. It's done. It plays no role in my life now other than to be educational. And I refuse to give that man another minute of my time and energy. I do not think about him at all now, except when I'm talking about trauma. I focus on what do I need to do today, right now, to feel better. Because that's where we have power, is right now at this very moment. What can you do right now to put your heart, your soul, and your bladder in a better place? And it's Super Bowl Sunday. So hopefully, if you love football, it's going to be a great day, especially if you're a 49ers fan, wink, wink. um, and there are plenty of IC friendly snacks. So rather than diving into the super spicy stuff, stick with the Lay's potato chips. Stick with the guacamole. Tortilla chips with cheese on. You're good. But can we do right now is just make good decisions that will put our heart and soul and our body in a better place. Susan goes, "Go Chiefs." Yeah, definitely. Hey, listen, my favorite player, Joe Montana, retired from the Chiefs. I like the Chiefs too, and I love Taylor Swift. So there you go. I don't quite understand Taylor Swift a lot of the time, but it's just a fun day, and let's just have fun with it. Sue says, "My husband's so upset the Lions lost. We're from Michigan." Girl, you're not the only one. You're not the only one. I will tell you, Kayleen is in here, and Kayleen and I hang out on Fortnite. And anybody else out there, if you love to play Fortnite, we would love to bring more IC patients in because honestly, it's just good fun. It's just fun. And I have to say, one of the highlights of the last year was playing with Kayleen during the Detroit Lions 49ers game, because Kayleen and her mom were diehard Lions fans. I was a diehard 49ers fan. They didn't know I was a 49ers fan. She goes, "Oh, wait, you're a 49ers fan, aren't you?" "Yes, I'm from California." And Kayleen, you do know what was the most entertaining thing about it is that I was 10 seconds ahead of you. And so I knew 10 seconds before you knew what was going on. Oh my God, Killian goes, "We had so much fun last night." We did. So if anybody here, if you want to hang out online and watch the Super Bowl with us, I'd love to do it because honestly, it was just an absolute blast. And we're gonna hang out tonight too. Oh, that was the 49ers and the Packers game. Yeah, you're right. It wasn't the Lions, it's the Packers. Thank you. Sue said, "I should ask my son if I can borrow his machine because he's too busy with his baby and I can learn." So absolutely. It's so fun. And you can play on it in so many platforms. I mean, Kayleen plays on it with PlayStation 4 and the PlayStation 5. I play on it with my laptop. And it's just super easy and it's just super fun. And there's just a lot of laughter and there's nothing gory about it at all. Let me go back here. Kayleen said, "I live with my mom and I regret not choosing to be raised by my dad. I probably wouldn't have had a bunch of CNS problems." Yeah. Well, honey, I mean, here's the thing. It happened. I'm really sorry that it happened to you. I'm really sorry that you experienced trauma like I experienced trauma. And I think yours was much worse than mine. But we can't live there anymore. It's over. And as you say, I will never do this to my future children. That's the entire goal here. We're stopping it. And please, to all the women, listen, I love men and I love all of you. I'm here for all of you. I don't care what your religion is, what your politics are, what's your sexuality, it's anything at all like that. I don't care. If you're in pelvic pain, I want to try to help you. But you have, for the women out there, you have to very clearly understand that our rights are being challenged right now. The issue of my lifetime is that women have fewer rights today than they had 10 years ago. And that's not okay. The Equal Rights Amendment has not even passed. That's not okay. There are some people on the record right now, politicians right now on the record, saying they don't think women should be given the right to vote. Believe me, there are people out there right now who want to take all that away. They want society to be dominated by men, specifically a certain type of man. And that's not okay. So we all have to stand up, be counted, and vote. And vote. Vote because your life depends on it. It does. Because if they pull your medical care away, your life will be at stake. Sorry, I'm not going to talk about politics anymore. Nancy says, amen. Absolutely. Donna says, oh, so here, hold on. So Kayleen said the reason she was 10-second delayed is because they were watching it through Hulu. Okay, that makes sense. Sue says, I don't mind a little gore. I'm a Walking Dead fan. There's no gore in Fortnite at all. Nothing. There's no blood, nothing. It's just basically running around a map and kind of having fun. Donna says, can you tell us more about the foam you mentioned for bladder pain? So if you've ever had, okay, so understand that nothing operates in isolation in the pelvis. Okay, everything is very interconnected. And so, for example, did you know that the nerves of the bladder and the nerves of the bowel actually merge at the spinal cord and become the same nerve? How did they figure that out? They put one radioactive tracer in the bladder. They put a separate radioactive tracer in the bowel. I used to do research like this. And then they followed the radioactive tracers as they moved up the nerves to the spinal cord, and they landed in the same nerve root and in the same nerve. So the bladder and the bowel are ultimately connected. We call it neural crosstalk. So we had research years ago which proved, we call it the pepperoni pizza algorithm, that when the bowel gets very badly irritated, the bladder will also show signs of irritation. Angel, hold that thought. And when the bladder is really irritated, the bowel can show signs of irritation. So again, that's called neural crosstalk. So not only does irritation spread, so does pain relief. So the theory behind this rectal foam is if you silence the nerves in the rectum and you reduce that pain response, that will then transition over to the nerves in the bladder. I have over the years had more than my fair share of rectal pain. From having very tight pelvic floor muscles around my rectum, but also having one freaking annoying internal hemorrhoid. It's a tiny little hemorrhoid. It's like the size of a sunflower seed, but it's on top of a nerve. And God forbid anything hard push on that hemorrhoid. It is not a happy experience for me. I bet it's too small to treat. I mean, the doctor's like, we wouldn't even treat this. This is and it's like, Jill, we're sorry, it's right on a nerve, but it'll move along, right? Okay. So if I was going through a period where I wasn't drinking enough fiber, wasn't drinking enough water, I basically had my bowel movements were like hard rocks, and it's as these hard rocks hit that hemorrhoid, it was not happy. And you guys, I'm sorry, I have no shame. I will talk about anything. We need to talk about these things. So if you struggle with hard rocks, hard rock poops, it's because you're not eating enough fiber and they're not drinking enough water. The combination of the two. So they have something called proctofoam, and that stuff is genius. In the old days, I used to use steroid inserts. The proctofoam is to die for good for calming the rectum down. And so I think that honestly, they're just kind of piggybacking perhaps on some of that research to see if they can get that pain to calm down. Well, hello, Paul. I love it when husbands join. My wife, she says, my wife has been following you for years. Yes. Thank you for being there for so many. She's had IT since she was 2008. Sex is not an option, and that causes its own set of emotional issues for her. I remind her I didn't marry her vagina, I married her. Happy Valentine's Day. Oh, Paul. Do you have a brother? Isn't that the perfect attitude? And honestly, Paul, we were talking about the Tenga flip hole. That's something that you guys could bring in that would give you some satisfaction, then keep her involved, but would not trigger any of that. And understand too that pain with intimacy is often because of very, very, very tight pelvic floor muscles. And when we do physical therapy and we really try to release and calm these, then um, sex gets easier. There you go. Ann says, do flares go away? Absolutely. Flares go away all the time. Sue says, is proctofoam a prescription? Yes. I think I have one. Here, hold on a sec. I think I have one so you can see it. Oh, ow. Oh, been sitting too long. Well, it's somewhere in my bathroom. It's not where I thought it was. Paul says, could I read it again? Your wife is in the room. You mean my article on Valentine's Day? Is that what you wanted me to read? I'm happy to read it again if you like. So let me know what specifically you want me to read. I'm happy to do it. Marlia said, I've been using estradiol cream 3 times a week and coconut oil on the off days for the dry feeling. Yesterday, I started feeling red, raw, and sore. Not itching, but sore. Can estradiol cream cause yeast infection? Not usually. I would back off on the coconut oil. After you have a bowel movement, it's when the rawness starts up. How to calm that down? It's proctofoam or prescription? Yes, it is. Marlia, call your doctor and talk to your doctor about it. Maybe they'll have you drop your estradiol down to 2 times a week. But it may be that the coconut oil is being a little irritating too. Oh, your comment. Sure. Okay, hold on a sec. Okay, to Paul's wife. Hi. He wrote, my wife has been following you for years, and thank you for being there for so many. She's had IC since she was 2008. Sex is not an option, and that causes its own set of emotional issues for her. But I remind her, I didn't marry her vagina, I married her. Happy Valentine's Day. You got to keep her, girl. You've got to keep her. That is wonderful. And there's going to be a moment when you're going to be there for him. And isn't this what being in a relationship is all about? It's being there for each other. It's navigating life's challenges with each other. You know, my dad lived until he was 100. My mom lived until she was 94. And their biggest moments were New Year's Eve. They celebrated their 75th New Year's Eve last year, and their anniversaries. And the blessing is, as we get older, we really realize that it's the connection, it's the day-to-day steadiness, it's the day-to-day kindness, it's the day-to-day navigating life's challenges and having kind of that give and take, and that, like my dad, he just want. We're Swedish and Norwegian. There were not a lot of hugs in our family. They're that's just the way they were. Um, but the love they had for each other, absolutely undeniable. And my dad just he did her laundry. He helped her walk when she was struggling to walk. He woke up in the middle of the night to help her get. Here he is, 100 years old. She's 94. He's getting up 2 or 3, 4 times a night to help her onto the potty next to the bed because he wanted to do that. And we just put on their we finally got confirmation with their headstones, a 75-year love story, because that's what couples do. They're for each other. So blessings to you both for having such a strong, wonderful relationship and being so incredibly understanding of each other. Paula says, will Miralax help? I feel like I've been more constipated than before. Also, for some reason, the first 2 days of my period, I feel like my ovaries want to come out of my body. Before, I never had a period cramp. I had a follow up with my urologist on the 27th. Thank you for being an angel of light to all of us. Um, I think the way you describe that, you say you feel like your ovaries want to come out of my body. I think that you need to talk to a gynecologist about that. I don't know what that means, hon. I mean, could you have an ovarian cyst um, that has grown, that has not gone away naturally, that could be causing some of that discomfort? That's very, very possible. And the fact that you're having cramping with your period, more cramping than normal with your period, I really think you need to be working with your gynecologist on that to see if they can figure that out. Donna says, how many bladder rests should I take daily for maintenance? Well, you can take up to 4, but it's about finding what works for you. You might be fine with 1 a day. So what you could do is, we always suggest, because we're all so sensitive, start with 1, see how you do with 1 a day, do that for a couple of days. If you want to go up to 2, you can go up to 2 for a couple of days, see how you do. Go to 3, see how you do. You can go to 4. 4 is the maximum dose, but a lot of people don't go to 4. They're fine at 2, or they're fine at 1. And so, it's about finding what works for you. And I am not a more is better kind of person. I think a less is more kind of person. I don't believe in adding treatment and supplement and treatment and supplement and treatment and supplement. As an example, so they put me on a new blood pressure Okay, so I have very, very, very mild blood pressure, high blood pressure. Very mild. The cardiologist said you're fine. You don't need to do anything. The ER doctor, you're fine. So I was having some shoulder pain that I thought could have been my heart. It wasn't. It was my neck and my shoulder. My gynecologist was, I mean, my primary care was all, it's a silent killer. It's a silent killer. I want you on meds. I want you on meds. And I'm like, but my blood pressure was consistently anywhere from 125 over 85 to 135 over 85, right? And if I ate Chinese food, it went up to 140. Or if I got stressed, it went up to 140. But for the most part, it was very mellow. So anyway, she's like, I want you on meds. And I had so much stress caring for my parents. It's like, okay, I'll do the lowest dose of the mildest one you got. And it didn't really do much. And then I just got all freaky about taking my blood pressure. Way too much stress, dealing with my parents' death and all that. Girl, I hit my limit. I'm done. I'm over. Just leave me alone. So we tried switching to another one, and it shut my thyroid off. I'd only been on it for a month, and I felt pretty good. What I didn't know is it completely shut my thyroid down. And so when I went in for something, for when I was sick a couple weeks ago, they said, yeah, your heart's being a little funky, a tachycardia. So she's like, go get an EKG and let's do some blood tests. And the EKG showed a little bit of tachycardia, and the blood test showed that my thyroid was done. It was 300% higher than it should have been. And shockingly, and then, I mean, hello, I'm a pharmacologist. I looked at the side effects of the med. It's known for doing this. So I emailed my doctor. It's like, I'm done. I'm not going to mess up my thyroid for this. And she's like, no, stay on it. We'll just give you more thyroid. I'm like, no, I'm not going to do that. I'm not going to compound the problem. The cardiologist said I was fine. I believe I'm fine. I feel good. So I don't believe in adding more for me personally. But ultimately, listen, if my blood pressure were out of control, and as the ER doc said, if you're at 170 over 110 for a week, yeah, you need to be on meds. Absolutely. But he looked at my blood pressure. He looked at my blood pressure log for 2 months. He goes, I'd love to have your blood pressure. You're fine. So anyway. So annoying. Lisa says, what is bladder rest? Bladder rest is one of 4 chondroitin-based supplements that many patients use now to kind of coat their bladder. It's a much safer, it kind of does what Elmeron did. Elmeron was the equivalent of a chemical Band-Aid, but Elmeron is now linked to retinal disease and inflammatory bowel disease. And so definitely fallen out of favor. Chondroitin, on the other hand, it's actually a building block of the bladder wall, and we have research that shows that chondroitin is essential to the superficial integrity of the bladder wall, and it's indeed the most effective ingredient in a typical rescue installation. These are the installations done in Europe and Canada. They're not available in the United States. We do heparin rather than chondroitin. Anyway, so when the Elmeron issues happened, patients needed to transition, and it was Dr. Theo Harides over 20 years ago that created the first chondroitin-based supplement called Sister Protect. But that's an older formula. We have better formulas now. In my opinion, they're better. They have more methods of action. So let me get them so you can see them. Let's see. There's Bladder Builder, there's Bladder Rest, there's Sister Protect, and I gave away my Cystomend. So Bladder Builder is kind of a starter formula. It's very, very low dose, very gentle. So for people who tend to be a little bit more sensitive to things, you don't like taking supplements, we would suggest maybe starting with this one. And again, The concept of a coating makes the most sense for somebody with estrogen atrophy, IC subtype 2, bladder wall driven estrogen atrophy. Cysto Protec was the first formula that was ever created. It's just had consistently over the years, there have just been difficult challenges with it. Most recently, they just reduced the number of capsules in a bottle from 120 to 90, but they kept the same price. Very disappointing. And the most popular supplement now, and I think the most effective supplement, is called Bladder Builder. And the reason why I say that is because it has the most methods of action of helping. So Bladder Builder has chondroitin for the bladder wall. It's got quercetin as an effective antihistamine. Unlike any of the others, it has some essential probiotics in it. But most importantly, it has PEA in it, palmitoyl ethanolamide, which calms nerves down. What the hell, Sue? What? Sue has just said that there was a shooting at Joel Osteen's church. I love Joel Osteen. I get such joy from listening to him. What? I don't see. Oh, they got the what? God damn it. This has got to stop. It was a woman. A woman between the ages of 30 and 35 was armed with a long rifle and had a child with her. It was for the start of a Spanish language service. Do not even get me started. Connie says, I have IC with Hunner's lesions. I had my second hydrodistension and fulguration 2 weeks ago. Okay, hold on. Guys, can you just take a moment and let's just take a deep breath and just please say a prayer if you pray, for anybody who has been affected by any shooting anywhere in the United States or in the world. It is so sad that a for-profit industry, gun industry, has created such division to make a freaking buck. It is intolerable. Vote. Vote. I'm not going to tell you how to vote. I'm just saying vote. Okay, I'm not going to talk about that anymore. Let's go back. Connie says, I have IC with Hunner's lesions. I've had my second hydrodistension and fulguration 2 weeks ago. Last procedure was in November of 2022. I'm taking glucosamine, chondroitin, MSM. Would bladder rest be better instead? Okay, so Connie, it's very important that you understand the new research about what causes Hunner's lesions. So we have two prevailing theories. Theory number one, are you sitting down, is that it's a virus. When we biopsy a lesion, the center of the lesion, there is a massive inflammatory war happening. Inflammation is the equivalent of a biological war. It means the human body is fighting something. And the inflammation found in the center of a Hunner's lesion is profound. In contrast, for those of us who do not have Hunner's lesions, there's no inflammation or very, very little. And so we have, for the last 10 years or so, had a very strong, distinct movement that Hunner's lesions, number one, it's its own distinct patient group. When we do our phenotyping, we ask about Hunner's lesions because you have your own treatments and you have your own research. There is a movement across the world that Hunner's lesion should be called Hunner's lesion disease, and that they should not be bundled in with quote unquote other IC or bladder pain patients because you are a unique patient group that's 5 to 10% of the IC patient population. So it's researchers in Europe who made a remarkable discovery about 5, 6, 7 years ago that when they were testing the urine of patients with Hunner's lesions and comparing it to the urine of patients without lesions, they found virus. What they found two dominant viruses. One is called the polyoma virus. The polyoma virus is a virus that we all have. It's part of the normal human biome. And it is a virus that is normally silent. It is not active. But if a patient is immune compromised, the virus turns on in the bladder wall and causes wounds. So viruses, they're known for causing what we call hemorrhagic cystitis. And Hunner's lesions bleed. Hunner's lesions bleed so profusely, they call it a waterfall of blood. So for patients who, for example, are on immune suppression drugs for kidney transplant, that suppresses their immune system and bam, the virus turns on and infects their bladder. So we have multiple studies now from Europe that found polyoma, and then they also found Epstein-Barr, the virus behind mono. In fact, last summer, we had our first research study that was looking for when they identified virus with next generation DNA testing, they then used an antiviral medication. And the viral medication cleared up all the virus. Okay, so again, here we are in the United States. We're watching Europe going, you found virus? Really? Again? Multiple viruses. And the American researchers were very quiet. And we're like going, guys, what do you think of the European finding that we've got virus? And again, the Americans were like, for 5 years, they said nothing. What we didn't know is they were doing their own viral study. And this was through the National Institutes of Health MAP Research Network study. The MAP Research Network, which is the multidisciplinary approach for the study of pelvic pain, is the biggest research team in the world studying IC and pelvic pain and prostatitis. And they have samples of urine going back in time for hundreds of patients. So what did they do? They went back and they studied the urine. And you know what they found? Polyoma virus. So this is bringing up the concept then of what can we do to, number one, identify a virus. You can find all that research on the IC Network website. You're welcome to call me, and I'm happy to email it to you too, because this is from medical journals. This is not from this crazy lady on the internet saying this. I would, number one, ask for a blood test to see if you have any active virus. I was just working with a patient a week or two ago who had active mono, and the blood test confirmed it. And that was playing a role in her Hunner's lesions. And so it'd be interesting to know if you have an active viral infection. And from a supplement standpoint, one of the things that you could look at is just lysine. Lysine is an amino acid which interferes with viral replication. So if you have a history of cold sores or canker sores, you know that there's a product on the market called super lysine. It's a chapstick that you can put on a cold sore, and it cuts the cold sore growth by half. I've had canker sores and cold sores for many, many years now. I have my bottle of super lysine drops, and I have my super lysine chapstick that I use if I ever get one. And so it's applying that same concept of lysine to kind of overall viral infection. Those researchers were also doing this COVID lysine study And I don't know what the results of that were, but it was interesting. So something as simple as lysine may help calm a viral infection down to a certain degree. And again, now we've got research, our first published research study testing the use of an antiviral. The other theory about a Hunner's lesion is also quite interesting. And that theory is that it is a nerve. It is coming from a nerve that is very, very inflamed. Nerves that are inflamed release a substance called substance P. Substance P is damaging to tissue. So when you think about shingles, right, that rash is red. Why? Because that nerve is very, very irritated and very, very inflamed. Okay, so this concept of a damaged nerve. So a couple of years ago, there was a fascinating case study of a woman who had severe Hunner's lesions, and she had a severe prolapse. Her bladder was falling out of her. And when they went in to surgically repair the prolapse, they made a remarkable discovery that the front of her uterus was facing backwards, and the back of her uterus was facing frontward. Why? Because one of the ligaments that normally hold the uterus in place had broken. And so her uterus was free swinging like this. And it was causing what you call a strangulation injury. It was twisting on itself. And strangulation torsion injuries are very, very dangerous. If a man gets a strangulation in his testicles, they have to get in and repair it very, very quickly. Once things start twisting, blood flow gets cut off and all that sort of stuff. So anyway, they make this remarkable discovery. So they repair it, they untwist it, they get the uterus back in place, and they attach it properly so that it's now being held properly in place. And something remarkable happened. Her lesions healed completely. A total and complete healing of the lesions. She is considered a complete cure. So the name of that condition, and I'm going to type this out in chat for you. This is called posterior fornix syndrome. It is very easy for your gynecologist to check for, because basically all they do is they use a wooden speculum up by your cervix to lift where the attachment should be. And if lifting it resolves symptoms, then we know we're dealing with this issue. And I've worked with, since that research came out, I don't know, maybe a dozen patients who actually are posterior fornix syndrome patients. So that would be something else that I would want them to check for you to see if you happen to have that. So getting back to the concept of a supplement, listen, you've got an open wound in your bladder. Diet is everything for you right now. You have got to be pristine with your diet, because the last thing we want to do is cause more inflammation. You got an open wound. A cup of coffee is going to get into that wound, and that's going to cause inflammation. And as we started this meeting, we talked about new research that has now linked bladder inflammation to central nervous system inflammation and depression. So we want to make sure that we're doing everything we can to calm and soothe that bladder and get it out of inflammation. There's no supplement on the market that can make any credible claims with respect to Hunner's lesion. None. So we have to think instead about what do we want to try to accomplish. We know Hunner's lesions require lesion-specific therapy. We know that they don't usually respond to Elmeron. So the concept of a coating doesn't make as much sense. Doing something that can calm nerves down does make sense, because there's a lot of nerve inflammation going on. So you could look at Peora. Peora would be interesting. That would be fascinating to see if that would help. And then you could look at the two Supplements, other supplements that contain Pura. Allopath is a combination of organic anthraquinone-free aloe with PEA to calm nerves down. That might be a bit more soothing. Or you could do um, Bladder Builder, which has a chondroitin in it to have a little bit of a protective effect of the bladder wall. It's got quercetin for the antihistaminic effect. Um, um, I think that any of those would be better than the glucosamine chondroitin MSM you're taking. And I think the bladder rest would be rather pointless. Um, but you won't know until you try. And there's stuff out there that thankfully we have a lot of stuff you can try. We have a lot of stuff you can try. Is there any other news down there from Texas? 2 injured. Two off-duty police officers were there, and they fixed it. All right. Laura says, I found that I can tolerate foods that might be an irritant with baking soda, about 1 teaspoon with most meals. Is there a downside? Absolutely. Salt. Honey, that's a huge mistake. That's going to raise your blood pressure. And you got to understand that as women get older and they go through menopause, you lose your ability to handle salt well. And that's why like 50% of the women who go through menopause develop high blood pressure, because your body just can't process the salt as well. Like I'm not eating hardly any salt anymore. And so 1 teaspoon of baking soda with a meal, way too much. Way, way, way too much. I don't know anybody who would suggest 1 teaspoon. I mean, normally, this is an old school approach, maybe a quarter of a teaspoon in a glass of water, a half a teaspoon at the most. 1 whole teaspoon, that's just way too much. So you have one job, and that is to create an environment that will support healing in your bladder. If if you had an open wound on your hand, would you pour coffee on an open wound? Most people would not do that. Would you pour coffee that has had baking soda put in it to reduce the acid onto fresh open wound? No, not usually. Would you put coffee that's been treated with pre-leaf would you pour it on an open wound on your hand? And the answer, of course, is no. Why would I put anything that's brown on a wound that's trying to heal? That doesn't make any sense. Why would I do that? What do we normally put on wounds? Water, chamomile herbal tea, peppermint herbal tea, even honey. So I think you have to reconsider what you're eating here. If it takes pre-leaf and a teaspoon of baking soda, girl, you're eating some really irritating foods that could actually be hurting you anyway. So I would take a second look at what you're eating and try to back off on the more acidic foods. There's so much you can eat when you have IC. It's just a fresh, healthy, natural diet. We're just losing the fast food and the junk food, and also foods that are just high in acid, like grapefruit, lemon, lime, and also doing tomato sauces. If you love pasta, have pesto sauce, have carbonara sauce. And it's the quantity of acid that matters. Think about a cup of a tomato sauce is the juice from like a dozen tomatoes that have been cooked down. That's a hell of a lot of acid. Whereas if you just slice up a half a tomato and you fry it with some fresh garlic and maybe some fresh herbs on it, basil, much less acid in it that way. So I think I would be reconsidering that diet a little bit if I were you. Of course, I'm not your doctor. I can't give you medical advice. That's not my job. My job is to open up some new doors, open up some new windows, give you some new education, and kick you in the butt and get you back to the doctor. And I would also really want to know why your bladder's so sensitive in the first place. You're doing the equivalent of chasing the symptom. I understand that, but we gotta figure out what the underlying problem is. Is your bladder sensitive because you're in estrogen atrophy? Then we need to treat that correctly with topical estrogen. Is your bladder wall sensitive because it's being irritated chemically by something that you're consuming every day or smoking? Then we got to address that. If your bladder wall sensitive because you have very, very tight pelvic floor muscles, we got to address that. So we always want to focus on underlying causation, and we always want to focus on the concept of healing. Sue says, do people with Hunner's lesions also have other subtypes like people without Hunner's lesions? Yeah, patients with Hunner's lesions absolutely are going to have tight pelvic floor muscles. No doubt about that. Hey, Karen, nice to see you, girl. Carolyn said, so if someone has a nerve issue, does that mean the bladder nerves are inflamed? Yes. 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 You can have a perfectly healthy bladder wall. There's nothing physically wrong with your bladder that they can see. There are no wounds. And yet the nerves in your bladder can be very, very sensitive. So, and the nerves in my bladder used to be very, very sensitive. And they're still not as normal as they should be. But if you take somebody without nerve sensitivity, you can probably put 1,000 cc's of fluid in their bladder and they can walk around for a couple of hours before they need to pee. Whereas for people who have nerve sensitivity, you put 100 cc's of fluid in our bladder, 10%, and we're running to a bathroom within 10 to 15 minutes. Why? Because the alpha afferent nerve, which is the nerve that controls frequency urgency, got turned on because our nerves are very sensitive. Rhonda says, the only thing I enjoy about the Super Bowl is the food. Luckily, I'm not diet sensitive since my hunters are gone after the havoc they caused 20 years ago. But you do have the scar tissue. The one thing I'm trying to get my providers to understand is since I was hit by that semi in 21, my hip was injured, and that is now connected to my IC. I think it's more pelvic floor than IC. It is, honey. Absolutely. Your intuition is absolutely right. And Rhonda says, oh, what a wonderful man that is. Everybody deserves a partner that is loving. Exactly. Carolyn says, how do you heal the nerves? You stop tweaking the nerves. You have to stop tweaking the nerves. And we have to calm inflammation down throughout the body. That's how I started this meeting, is we have to calm inflammation. See, the new research shows that you can start with bladder wall irritation. And bladder wall inflammation. And that then can spread to the central nervous system, to the nerves, which can then reach the brain, which can then cause depression. So now we'd have research that shows that instead of thinking that for some people it's a top-down approach where there's something happens like mental illness, which eventually causes their bladder wall to have an issue, what this research is saying, no, it's the exact opposite. That if the bladder wall is consistently inflamed over time, that inflammation then becomes systemic inflammation. It starts regionally in the bladder, and then it starts to affect the whole body. And eventually it affects the central nervous system and the brain, where it can result in depression. So therapeutically, what do we need to do? We have got to get super, super serious about addressing inflammation. So this is an article that's going to be in our Winter IC Optimist that we are finishing up this week. So how do we reverse inflammation? Number one, eat anti-inflammatory foods. Your food choices protect you against inflammation. You want to eat more fruits and vegetables. And remember, there's a ton of veggies that are IT friendly, and there's a ton of fruit that are IT friendly. Just stay away from the citrus for the most part. And eating foods that contain omega-3 fatty acids. So eat more leafy greens like spinach and kale, cruciferous vegetables like broccoli and cauliflower. I love broccoli. I hate cauliflower. Nuts and flax seeds like almonds, chia. I eat Kind bars every day. Eat various fruits that are bladder friendly, like low acid gala or Fuji apple, berries, bananas. Um, fatty cold water fish, like mackerel, tuna, or salmon. That's where I flunk. I do not like fish at all. Uh, Using olive oil and some spices can help reduce inflammation, like ginger and rosemary and turmeric. Number two, quit smoking, because all of those byproducts from smoking, vaping, and chewing accumulate in your urine, where they irritate the bladder wall and cause inflammation. And it's not just for you, it's going to be people in your family too. We now have research that shows that children exposed to secondhand smoke also will develop urinary symptoms. My mother smoked during her pregnancy with me. You know, she got married in her 50s when smoking, doctors were doing commercials saying smoking was safe. They all smoked back then. Boy, did those tobacco companies have a reckoning. Okay, number three, limit alcohol. Alcohol is known for being inflammatory. Number four, cut back on inflammatory foods like red meats and anything with trans fats such as margarine, corn oil, deep fried foods, or processed foods. Air frying is much better. In fact, I just got a new air fryer that I've got to try. Number five, control blood sugar. Did you know the food companies have added sugar to many of our common foods to trigger an addiction response because they want you to buy more? Yes, they want you to become addicted to those Fruit Loops and whatever it is you're buying. And they have refused to consider the long-term harm that their sweetened foods have caused. Also, limit and avoid simple carbohydrates such as white flour or white rice, refined sugar, or anything with high fructose corn syrup. For God's sake, if you're making pancakes, don't put syrup on it. Put some fruit on it. And then opt for whole grain rather than white breads. And again, my favorite bread is Ezekiel bread made by Food for Life, which is whole grain that is high in protein and lower in carbs. Make time to exercise. You should be exercising 4 to 5 days a week, including cardio, walking, biking, and also 10 to 25 minutes of strength resistance training. Work on managing your stress. Stress has been my middle name in the last few years, especially with the loss of my parents and being their caregiver. We have to find ways to release stress from our body. I do this by taking walks in my local park, spending time with friends and family, painting, reading lots of crafts. I usually listen to several books on tape. And also know that the IC Network has on our website several free guided relaxation tapes designed for pelvic pain that have been proven in research studies to reduce pelvic pain. And you can find those right on the IC Network website. And also improve sleep. Getting 7 to 9 hours of sleep per night is recommended. Of course, that's hard when you have to pee all the time. But try to make sure that you're at least going to bed and waking up at the same time. You're sleeping in a cool, dark room. And try to avoid using your iPhones for an hour before you go to bed. That's like almost impossible for me. I think that that's the most difficult challenge for all of us. And if sleep is an issue, then we got to figure out why you're getting up so much at night. Again, that nighttime urination is often a direct reflection of something that you're eating during the day that you think is okay. That's not okay. That's providing long-term inflammation, like green tea, black tea, a multivitamin like a Centrum or a One-A-Day, vitamins that contain ascorbic acid as a source of vitamin C, etc. Even drinking water out of a Brita water filter. The water filter is too strong. It takes all the pH balancing minerals out, and you end up with some acidic water. So that nighttime urination is usually a sign of something during the day that's continuing to tweak your bladder. Laura says, I know, but my blood pressure has gone way down, but I will get better measuring. And let's see here. Laura says, at Pre-Leaf, I keep a bottle and a couple in my purse. Marlia says, my uro nurse practitioner says to take turmeric for bladder inflammation and joint pain. I have fibroid too. I'm nervous. Have you heard of turmeric? Yes, I have. And in fact, Natural Approach Nutrition is going to have a new product that is going to be focusing on calming a lot of that inflammation down. I'm not sure if it's available yet, but it's something that they've been talking about. So yes, if you tolerate it, fine. Karen, girl, your pudendal nerve block worked for 6 days. Holy mother of God. Woman. Wow. Doesn't that open up just a whole new line of therapy for you? That is so incredibly exciting. Congratulations. Sue says, I can have a BLT, but I can't have tomato sauce on spaghetti or pizza. There you go. Karen says, so now I'm scheduled for a ganglion impar nerve block, and then in 2 more weeks, caudal epidural, and then pudendal nerve ablation by radio frequency. Finally, they're getting to the underlying problem for you. That's fantastic. Congratulations, hon. Congratulations. Anne says, can I use coconut oil internally? I would not. Sue says, has anybody tried a microwave air fryer combo? I don't know. Karen said, I had an injection into my SI joint recently, which helped with my back and pelvic pain. When the injection wears off, I have an ablation. Keep us posted. Yeah. Oh, that's from Lori. Sue says, not even real maple syrup. I use a very small amount. I dip, not pour. You know what I do, Sue, is I buy a blackberry, like a homemade blackberry jam that I will put on pancakes. Paola says, Piora calms nerves. Yes, that is a general assessment that Piora, palmitoyl ethanolamide, acts by calming nerves down. Karen says, the best brand of water for me on the West Coast is Arrowhead. I second that. Arrowhead is definitely the best. Best brand on the East Coast is Poland Spring. Good to know. Karen, I don't know if you saw, they actually shut down Calistoga water last month, that we can't get Calistoga water anymore. Barbara says, hi, Jill, you're amazing. Thank you, Barbara Parker. You're very, very welcome, and you're amazing too. Carolyn said, so do foods and drinks bother inflamed nerves? Absolutely. Absolutely. Especially foods that are neurostimulatory, like coffee, anything with caffeine, and also chocolate. And I started this meeting out by doing a little demo of some new Cara products that we have. This is the Aussie Shark Bar, and then the Aussie Caramel Corn Bar, and then also there is a Crunch Bar. And I've been eating the Crunch Bar for the last couple of days. So it looks just like chocolate, but it's not neurostimulatory. And I'm going to tell you, my friends, so good. I try not to eat on stream because I don't think I'm a pretty eater. Okay. First sensation, it's just this wonderful, rich, chocolate-like flavor. Smooth, super satisfying. It tastes very, very high quality, not like cheap milk chocolate. Carolyn says, where do you buy the candy? In the IC Network shop, icnetwork.org. Go to our website and just go into our store. Oh, if an orgasm could happen from eating something, this would be it. We also have carob chips, sweetened and semi-sweetened. So good. You got to savor it. You don't just chew it up and swallow it. You have to enjoy this fabulous. I mean, it's like it's how I would think chocolate cheesecake would taste like, you know? It's just so, your mouth is just filled with this fabulous flavor that's unlike anything else. Okay, I hope I don't have chocolate or carob on my lips. Kayleen says, I got 5 minutes before the game starts. Okay. Ann says, what can I use for internal for lubrication? KY. Lori says, I love watching Read the Carob. I'm going to order. Yeah. Also, we still have boxes of carob cake mix from Missy J's. We're not going to have that in the future. Those are going to be the last the last boxes, because the company got sold to another company and we just can't work with them. They require a 10,000 minimum or wholesale order. And we're a small business. We don't order $10,000 worth of carob. Sue says, I'm not trying to call you out. I'm confused. I'm not a candy eater. Why is a tablespoon of maple syrup worth than candy? I really want to know. I also do like an occasional pastry. Well, it's about quantity. And it's all the problem with most syrups is that they're high fructose corn syrups. And those cause a lot more inflammation than, say, honey. And so if you're going to go for a sweet, just go for a really high quality sweet. A little bit of honey. I don't have a problem with a little bit of honey. Honey is known to help wounds heal. Um, so there's not that much of a difference. I mean, I don't eat candy very often because I have a lot of root canals and crowns in my mouth. And I'm very, very, very invested in my tooth health. And so I had to eat it because I had to try it to see if I like it. And I wanted to show it to you, but then these bars I'm probably going to throw away because I don't want to eat that much sugar. I'm trying to lose weight. Or I'll stick them in my freezer and I'll save them for, I'll have like, I mean, how many calories is it? 10 of these is 260 calories. So I'll save it for reward therapy. If I do something that I find hard, like going to the dentist or talking about medical stuff with my doctor, which I'm an old health anxiety person anyway. Larissa says, have a great week, everybody. Super Bowl time for me. You're right. It's about that time, my friends. So go 49ers, my home team. You will see me again next Sunday, knock on wood. And if you ever have any questions and you want to reach out, feel free to come on over to the IC Network. My email address is icnetwork@mac.com. Please be a squeaky wheel if you don't hear from me the first time. You're welcome to email me over and over until you get a response. Or better yet, give me a phone call. I just know that Mondays are usually my day off. And so, because this is a work day for me. And I gotta have my calm time. So we're going to call it here. Everybody be well. Have a great Sunday. And let's just enjoy the rest of the evening for what it should be. And also send prayers for down to Joel Osteen's church. All right. Okay, my friends, I'll see you later. I'm going to say goodbye to YouTube first. Bye, you guys.